I'm Kyle Fletcher. I'm an ear, nose, and throat doctor, and I've worked for Ephraim for almost 2 years. Most of what we see in our clinic is seasonal allergies, and it's typically things like trees, grasses, weeds. Ragweed is a big one. Food allergies are common, and probably the most worrisome for that is peanut allergy. But we typically treat seasonal allergies in our office. That can be tricky. Seasonal allergies can present in a lot of different ways. One of the most common causes is causing a runny nose, but there's a lot of things that are caused by seasonal allergies. Waking up with a sore throat or having postnasal drip that irritates your throat can make you hoarse. It can cause people to have chronic ear infections or fluid on the ears. It can cause chronic sinusitis, feeling like there's a sinus infection that just won't go away. So it can show up a lot of different ways. Typically in our offices, we will interview you, get your history and exam, and a lot of times we'll start treatment without doing any specific tests. A lot of times treatment with certain medications directed toward allergies can be all that's necessary, but there are options like skin testing for refractory cases. Typically for seasonal allergies, what we start are oral antihistamines and steroid nasal sprays. Those are the biggest things, and there are some other types of treatment options that we can direct toward different complaints, sometimes eye drops if you're having ocular symptoms. One of the biggest things that I've started doing myself in the post-COVID era is mowing the grass with your mask on. It sounds crazy and you may get some funny looks from the neighbors, but just keeping all of the grass and allergens and pollen from stirring up while you're mowing is a big thing. Other things you can do is make sure to change your air conditioner filter periodically, and then make sure that your bedding is washed routinely in hot water, and even things like a mattress cover can help. If you're having things like waking up with a sore throat, having chronic ear infections, muffled hearing, or having the sensation like you have fluid on your ears, or having sinus symptoms that just won't go away, those are all reasons to come see us at our office. Now there are severe allergic reactions that they call anaphylaxis, and those can be life-threatening. Typically if you experience symptoms like that with scratchy throat, trouble breathing or trouble swallowing, and a splotchy rash, you may need to call 911 or proceed to your nearest emergency room. One of the biggest parts of my practice is trying to tease out if someone has allergies or chronic sinusitis, or maybe they just have an anatomic problem with their nose preventing them from breathing well. So we do some detailed tests and studies to try to get to the bottom of that. And just going off symptoms alone, it's hard to figure that out. But finding out the problem can lead us to the solution, and a lot of times a procedure, typically outpatient, would be all that's necessary.